Hello and welcome to Minutes with the Coach Success in Dentistry mini-series, episode 7. In our last episode, we explored the concept of becoming a person of influence with your patients. We explored something we called the influential oral health coaching model. So remember, no matter what role you play in your practice, you are also an oral health coach to your patients. And in order to be able to serve our patients effectively, we must be able to inspire them to take action on their dental health opportunities. But rarely is influencing another person a job of straightforward persuasion or saying the right thing or use this script and your patients will take action. Persuasion or human influence is better described as an effort to create conditions for change. The oral health coaching model is actually a mental construct of human needs that must be fulfilled in order to engage our patients or in order to enable our customers to reflect, to decide, and to act on their best interests. Our interactions with our patients must facilitate a synthesis of ideas that allows people to tap into their hearts, to tap into their own minds, and to come to desired conclusions in their own minds. And we, as oral health coaches, are merely navigators of this process while the patient remains in the driver's seat and feels in control of the entire process. So today let's look at the first of the 5 variables for human influencing. So let's take a deeper look at it. And the first variable is that we must have trust. Patients must be able to trust us, but the best way for someone to trust another human being is to actually be in relationship with that person, and a high-level relationship with that person. You see, people are influenced most by people they like, but this step is so basic that many people ignore or fail to apply it fully. The fact is, at the end of the day, most of us or all of us feel more trusting and open to people we like, people that seem similar to us. And the more we feel connected to someone or a part of someone or liked by someone, the more influential that person will become within our lives. So look around your practice today and ask yourself, are you caught up in the hustle and bustle of daily routine to a point where it actually obscures the patient? I remember having a discussion recently with a doctor about relationship building, and his comment to me was, Peter, I connect with my patients, but I don't know if I can do that fluff stuff. And I thought to myself, wow, fluff stuff. Well, isn't that fluff stuff what a relationship is really made of? Because at the end of the day, the more connected they feel, the more connected our customers feel to us, heart to heart, soul to soul, the easier it will be for them to actually buy from us. So let's move on here. Let's look at how we grow our business today. The best way to grow your business is to grow it one relationship at a time. It's very easy to see within your practice when you bring in the next patient, bring in the next patient, bring in the next patient, go to work, come home, make dinner, bring in the next patient the next day. It's very easy to get into this routine where you see the same different face each day. It's so important for us not to lose sight of the people that are actually attached to the teeth. Otherwise, they become the same different face. And dentistry, I believe, is a people profession. Your dentistry gets you into a game where relationships win. Because at the end of the day, just as Starbucks said, without coffee, Starbucks said we're not in the coffee business serving people. We're in the people business providing coffee. Well, isn't the same thing true for dentistry? At the end of the day, we are not in the dentistry profession serving people. We're in the people business providing dentistry. And without people, you have nothing. But with people, you have something that is much bigger than dentistry. And I remember a good example of this. One morning, about 5:30 in the morning, I stopped into a local coffee house in my neighborhood here in Aurora, Ontario. And was about 5:30. I remember it was still dark out. There was snow all over the place. It was cold. And as I walked into this coffee house, there was a few people sitting around drinking coffees. Everyone kind of had their heads down. People looked serious. The morning bugs, there was kind of a, morning breath, morning bugs, bad energy in the air. And the girl behind the counter, this 17 or 18-year-old young girl, was whistling and smiling, and she was almost behaving like the sun was shining and like she was in an oasis on a beach somewhere, catching the morning sun. And I remember after I got my coffee to her, I says, "Wow, thanks, you really put me in a good mood. You rubbed off on me." And she looked at me, and in a very sweet voice, she said to me, "Well, you wouldn't want to buy coffee from a sad person, would you?" And I remember that really touched and warmed my heart. And I started to enjoy going there in the morning and buying from her because she was in such a good mood that it just started my day off right. Well, think about this. Is that not the same in the world of dentistry? I mean, in dentistry, focusing on the technical details of taking care of the mouth can actually blur the patient or person that's attached to the teeth. It's almost like that drunk driving commercial, if you've ever seen it. It's a commercial where someone's driving their car at nighttime, and all of a sudden one wine glass is moved in front of the car. So now you're looking through the rear view, through the windshield, and through that wine glass in order to steer your car. Then a second wine glass comes in, then a third, until pretty soon there are so many wine glasses in front of the car that you can no longer see the road, and that person gets into an accident, like drunk driving. Well, is it possible that dentistry can sometimes obscure our view, our focus on dentistry can sometimes obscure our view of a patient to a point where we're actually behaving like a drunk driver and merely focusing on the person attached, on the teeth and not the person attached to the teeth? So at the end of the day, I believe that your greatest competition is not other dental offices or the office down the street. It's an attitude of indifference. And your capacity to care, or the capacity to care, is what really gives our lives its deepest meaning. You see, two people achieve a strong relationship with each other by reaching beyond the boundaries that they usually maintain between themselves and strangers. And the question we need to ask ourselves in our office when we do what we do every day is, do we bring in the patient and start on their teeth right away, or do we focus on the human being? And the key is to find their heart. Find your customers' hearts, and they will give you their teeth and mouths. So there's a book that's recently written by Tim Sanders. It's an international bestseller, and it's called The Likability Factor. In this book, Tim Sanders points out that the key ingredient to getting ahead in life and in business is to be likable. When you're likable with other people, you tend to be much more effective in your interaction with that human being. And he describes likability as consisting of 4 very important factors. And he describes it almost like driving on an isolated road, where you're driving on a road to a point where you hit a stoplight. And that stoplight represents friendliness. And he says friendliness is your ability to communicate liking and openness to other people. It's like a radio emitting tower. And he says when you are friendly with another person, the light turns green and you can actually drive on with that person until you hit the next stoplight, which represents relevance. Relevance is your capacity to connect with other people's interests, their wants, and their needs, to really be able to tune into another human being. He says once you achieve relevance, the stoplight turns green, and you're now able to continue forward and drive on with that person in your relationship with them. The next stoplight is actually empathy, and empathy is your ability to recognize, to acknowledge, and to almost experience other people's feelings or the cause behind their feelings, to really be able to tune in and connect and become one with another human being. Once you achieve empathy with that person, then again, the stoplight turns green and you're able to drive on to the next stoplight, which is realness. And realness is what ties it all together. Realness is the integrity that stands behind your likability and really guarantees its authenticity. So, how do we do this in the world of dentistry? Well, in the world of dentistry, it would help if we look at the 4 levels of business to customer connections and extrapolate it to our world in dentistry. So there are 4 levels at which we are able to connect with another human being in the business world. And the challenge is not to appear warm and gracious and interested with our customers. The challenge is to actually be and feel warm, gracious, and interested. Because the best influencers are people who are actually interested in other people. People who connect with others not just because they need to in order to influence them, but because they actually want to. And if you are someone who couldn't care less or feels little interest or sentiment towards others, then it will be very difficult to persuade that person or to influence them. So if we look at the business world, there are 4 levels at which we can connect with our customers. The first level is disconnected or serious, professional distance. It's apathy. It's almost like in the 1970s when you went into a bank. You know, it's very kind of professional. We don't joke around here. We have a job to do. Let's focus on what we need to do. This is important, and the environment is devoid of humanity. But then someone came along and said that, well, that's not enough. We actually need to be polite and nice to people. So this brings in the next level of connecting with people, which is polite, cordial, or using nice words. Think about it. Telling someone, hello, thank you, please, next, being nice to people through the use of nice words. There's something to it, but then there's a next level of human connection. And that next level is someone said that it's not enough to just use nice and polite words with people. We must engage in social graces. And I like to call this almost counterfeit sincerity, superficial pleasantries, overly sweet niceness. It's almost like I've seen people engage in rapport with other people, but it's merely a step that they take. It's not actually a feeling. They're kind of going through a process before they can actually start their work on that person. And the last or the highest level of patient connection is actual love, caring, connection, applying a personal touch to what we're doing with these people, being in unique relationship with them. So if we look at these 4 levels, I'd like you to ask yourself, where do you fit in those 4 levels when you engage with your customers? Because you fit somewhere in there. Are you disconnected and serious? Or are you at the next level, which is we are polite. We use nice words when we seat our customers before we serve them. Or are you at the next level where you engage with people in kind of the social graces, a little bit of kind of the pleasantries. How are you? How was your day? How was your drive here? Great. Let's get on to taking care of you. Or are you at the highest level where you have a loving, caring, personal connection with your customers? Now, I would like to ask you a second question. Not only where do you fit on that scale, but the second question is ask yourself this. Which one of these steps or levels would be the worst? Think of it. Which one is the worst to operate in? And if you think about that for a moment, you'll notice that it's not number 1. It's not being disconnected, serious, and professional. It's actually number 3. It's the social graces. It's the counterfeit sincerity, the superficial pleasantries. People hate phonies. If you don't care about someone, but you pretend to through the use of nice, almost shallow dialogue, to them that's much more insulting than merely getting right to the business at hand with that customer without doing rapport at all. So those are the 4 levels of business to customer connections. Now, let's look at some strategies for connecting more deeply with our customers. What can we do in our practice on a daily basis to create deeper, more fulfilling connections with our customers so that our customers are more inspired and influenced by our advice and more willing to take actions that are in their best interest through the medium of dentistry. So what can we do? Well, let me give you some steps. The first one is that before you bring in a patient, you should sit down for a moment, quickly pause, and do what I like to call a preceding state change, which is develop a genuine curious interest in the person that you're dealing with. Tune into who they are. Tap your consciousness into whom you're about to serve. Eliminate all the work issues that are going on, your last patient, the next patient, thinking about team issues or what's going to be happening tomorrow, and become an empty cup or an empty vessel that is there ready to receive the person you're about to care for. Step 2 is once you've done a state change and mentally tuned into your customer, which takes about 10 seconds, it's like flicking a switch. Step 2 would be start each appointment with human connection and find their heart before you find their teeth. In a nutshell, take the time with your customers to speak with your customers on a human level. Step 3 is if you're running behind in your office, or step 3 is not if you're running behind, don't run behind in your office. Conduct yourself in a more calm, patient, and attentive manner. Think about this for a second. If you're running behind in your office, you may be physically present with your customers, but mentally and emotionally you're absent. You're still running around trying to get caught up, and patients will feel this. They'll feel your absence when you're with them. So far we have do a preceding state change. Tune in to the person you're about to serve. Number 2, take the time at the beginning of the appointment to find their heart and to connect with the human attached to the teeth. Step 3, run your practice on time. Don't run behind, because this is the biggest killer to patient connections in business today. Step 4 is that patients must know you on a personal level also. It's not enough to merely bring someone in and say, how are you? How's your mother, father, brother, sister? What are you doing today? How do you feel? Where are you going? Rapport is a two-way street. Your customers must know you as well as you know them. So I believe the highest relationships are built on a two-way street where it's okay to actually share personal stories about yourself, about your life with your customers, so that it humanizes you in their eyes rather than merely seeing you as a dental professional. And step 4, the next step is avoid baby talk. And what baby talk is kind of this overly sweet niceness, or everything they say is great talk. You see, don't confuse nice talk with connecting with customers. Be real, be human, and keep it authentic. And the next step is practice high-level listening. Because high-level listening, when you think about it, listening is something that's deep. There's a big difference between hearing and listening. Hearing is an involuntary passive act of receiving sound, but listening is the act of receiving that sound and understanding its intended meaning as it is intended by the person that's delivering the message to you. So note the difference between hearing and listening, and take the time to listen to your customers. Receive them fully. Become an empty cup or an empty vessel that's fully there, and allow the other person to fill up your empty cup or empty vessel so that they feel heard and understood in your presence. And the next step is develop the art of storytelling. And all that is just be a storyteller. Be able to share enthusiastically with other people and express things to them that would be of interest to them. And lastly, when a person leaves your office, when you've finished taking care of a patient and they walk out of your treatment room or out of your office, ask yourself a question. How much did that patient like me? And I'd like to give you a formula for knowing the answer to that, and it works every time. Whenever you ask yourself, how much did that person like me? Look into your own heart, and the answer is right there. It's as much as I showed I like them, and not much more. And so there we have it. Relationship building is the most important part of your business. And if you want to influence your customers, the first step to becoming an influential oral health coach is to actually be in relationship with your customers. Being in relationship with your customers will create a trusting environment, and patients must be able to trust you in order to accept your advice. How do we do this? Well, find a commonality with your customers, show an interest and warmth in them, show them that you appreciate them and that you appreciate their unique qualities, smile, show an interest in them, encourage them to talk about themselves, make them feel important, pay close attention to what they're saying. And there you have it. Step 1 to the oral health coaching model is developing a trusting relationship with your customers. To learn more, please feel free to call me at the number listed below. And on behalf of myself, Peter Barry, and the Halton Peel Dental Association, we look forward to seeing you next month, where we will continue exploring the oral health coaching model. We will explore the second of the 5 human influencing variables. See you next month.